Multimorbidity is a pretty big problem, really. It affects a significant proportion of the population, and it can actually lead to some really serious negative health outcomes. So people with higher levels of multimorbidity are more at risk of things like having cancer, having cardiovascular disease, having strokes, and things like premature mortality. So whilst it's common, it can be pretty serious depending on which long-term conditions that you have.
As a GP, it can be quite challenging to help patients with multiple long-term conditions, as the care required is quite complex. We live in the era of evidence-based medicine, where GPs often refer to guidelines and recommendations based on scientific evidence. I can count on my fingertips how many guidelines and recommendations are available when it comes to managing people with multimorbidity or multiple health conditions, and that needs to expand, and it can only expand when there is further research looking at what innovative ways of managing people with multiple long-term conditions we can come up with.
We're very much a primary care focused research department, studying generally the impact that multimorbidity has on patients in primary healthcare, and really how we as researchers can help improve primary care services really for patients that have multimorbidity.
My research focuses on trying to understand why individuals with serious mental illness have increased rates of obesity, diabetes and cardiovascular disease than the general population. This is important because the lifespan of those with serious mental illness is much reduced compared to the general population, and reasons for this are not entirely well understood. It is possible that if we can identify common roots to the different disorders, be it mental or physical, then some drugs that are currently being used for physical illnesses might be repurposed to improve the lives and the long-term outcomes of those with mental illness. I'm trying to use genetics to understand whether or not there is common biology underlying both physical and mental illness. This is useful because genetics are set at conception. After that, it doesn't matter which diseases or conditions you have. Your lifestyle does not influence your genetic variation. So we can use the genetic predictors of certain conditions to investigate the impact of those conditions on other conditions. So we can try to understand whether there is common biology and how we might use this new knowledge to improve the lives of the people with serious mental illness.
There's really a huge swathe of research that can still be done on multimorbidity, both from the qualitative and also from the quantitative side. So there's a lot of questions still to be asked about patients' experience of multimorbidity, but not only that, but there's a lot of kind of statistical research still to be done on what multimorbidity actually does to people long term.